Winter regulations to keep you safe this winter. You might have noticed that when you go to a restaurant or shopping, there's a shortage in staff, and that causes a delay in services. That is happening in hospitals as well. Many people are too sick to go to work, and the hospitals are very busy because many people are tested positive for COVID, and many are very sick and they are in hospitals. The new COVID-19 variants are expected to continue to cause increases in new cases, reinfections, hospitalization, and deaths. Some changes have been made to pandemic orders by the government to allow Victorians to live safely with COVID-19 while reducing transmission, hospitalization, and the number of deaths. Where to wear a mask? Face masks must still be worn on public transport, taxis, ride-shares, and planes, but will no longer be required at airports. Masks are also required in sensitive settings such as hospitals and care facilities. It is strongly recommended to wear a mask when you are indoors and in crowded places to protect yourself and others. COVID-positive cases must still isolate for 7 days from the day they took their test, but may now leave home to drive a household member directly to or from education or work without leaving their vehicle. They can also leave home to get medical care, a COVID-19 test, or an emergency, including the risk of harm. They can also leave home to drive a household member to get food if essential. The infected person will need to remain in the car and wear a mask all the time. If you have tested positive for COVID-19 and have completed 7 days of isolation, you will have 4 weeks from the end of your isolation date when you do not need to get tested or isolated if you have symptoms. After 4 weeks, you must get tested if you have any symptoms. Residents at care facilities, including residential aged care and disability, are able to see any number of people as long as they test negative on a rapid antigen test that day. But centers may introduce their own visitor rules to respond to local risk. Remember, if you have COVID or flu, speak to your GP about antiviral medication if eligible. Ensure you have had a flu vaccination, which you can have it at the same time as COVID vaccine. If you are unwell, stay home to keep others safe. People who are 30 and over and haven't already received their 4th dose are strongly encouraged to have it. You can do this 3 months or more after your 3rd dose of COVID-19 vaccine. Working from home is recommended. While we are out in the community, we all need to work hard to stop the virus from spreading.